How does masking affect diagnosis? Masking, also known as facial masking or hypomimia, is a common symptom of Parkinson's disease. It involves reduced facial expressiveness due to impaired control of facial muscles. This occurs because Parkinson's disease leads to a loss of dopamine-producing nerve cells, affecting motor function, including facial expressions. Understanding how masking impacts diagnosis is crucial for accurate assessment and treatment. One major way masking affects diagnosis is by creating a challenge for clinicians. When a patient has facial masking, it can be hard for doctors to gauge their emotional state. The face may appear flat or emotionless, even if the patient feels emotions internally. This disconnect can complicate the clinical impression and may delay the recognition of Parkinson's disease symptoms. If the lack of facial movement is mistaken for other conditions or psychological states, it can lead to misdiagnosis. Additionally, masking impacts communication. Nonverbal cues are essential for conveying feelings and reactions. When patients cannot smile, frown, or show other facial expressions, misunderstandings can arise between them and healthcare providers. This can obscure the severity or presence of other Parkinson's symptoms, such as mood changes or cognitive impairment. As Parkinson's disease progresses, the severity of facial masking often increases. It is typically associated with more advanced motor symptoms and may correlate with cognitive decline. Recognizing facial masking early can provide important clues about the disease stage and progression, aiding in a more accurate diagnosis and timely intervention. Masking also plays a role in differentiating Parkinson's disease from other disorders. Since facial masking is a motor symptom specific to Parkinson's and some other neurological conditions, its presence can help distinguish it from conditions that do not affect facial muscle control. However, because masking can resemble emotional blunting or depression, clinicians must carefully evaluate to avoid misdiagnosis. Moreover, masking can give the impression that a patient is uninterested or unmotivated, even when they are not. This can affect the clinical evaluation of mood and cognitive symptoms, which are important in diagnosing and managing Parkinson's disease. Awareness of masking helps clinicians interpret behavioral observations more accurately. In clinical practice, understanding and identifying facial masking is crucial for diagnosing Parkinson's disease. It requires careful observation and sometimes the use of rating scales that include hypomimia as a characteristic feature. Treatments that improve dopamine function, such as levodopa, may reduce masking and improve facial expressiveness, which can also help confirm the diagnosis. In summary, masking affects diagnosis by complicating the interpretation of facial expressions and emotional communication. It influences assessments of disease severity and progression and requires careful differentiation from other conditions. Recognizing this symptom is essential for the timely and accurate diagnosis of Parkinson's disease. Always consult healthcare professionals for personalized medical advice.